Inappropriate renal dosing is a kind of a complex topic, more than people realize. The primary factor is that renal dosing is highly individualized. For example, a young person with only maybe one chronic disease, taking 2 medications, has a lot of physiological reserve and can sustain extremes in dosing. Whereas an older person who lives with 4 or 5 chronic diseases and has impaired renal function already and low physiological reserve is much more likely to sustain problems due to inappropriate renal dosing. So for that older person, renal dosing has to be much more aggressive. So that's problem number 1. Problem number 2 is typically renal dosing adjustment isn't recognized as a problem until it becomes a problem and it hits the hospital door. We usually only address it when somebody goes into acute renal failure or has some very obvious sign of toxicity. The third factor is that there are a lot of medications that have renal adjustments, but people don't recognize that. For example, some statins, fexofenadine or Allegra, duloxetine or Cymbalta. There's a lot of medications that have pretty significant renal adjustments that we don't think of them as having renal adjustments. And then lastly, the system, the healthcare system. Inappropriate renal dosing occurs in particular because the healthcare system is very complex and it doesn't seem to be any one person or profession's obligation to ensure that it happens correctly.